Hello everyone. In this class, we'll learn about fibrinolytic system. This system keeps lumen of blood vessels patent by dissolving clot. Plasmin is an active component of fibrinolytic system, which is also called as fibrinolysin. The endothelium of blood vessels, except those in cerebral microcirculation, produce thrombomodulin, a thrombin-binding protein. Thrombin thus binds to thrombomodulin and forms a complex. This thrombomodulin thrombin complex activates protein C. Activated protein C along with cofactor protein S inactivates factors like Phi8 and inactivates an inhibitor of tissue plasminogen activator. Plasmin is formed from plasminogen by the action of thrombin and tissue plasminogen activator. Thus, formation of plasmin is enhanced. Plasmin lyses fibrin and fibrinogen with the production of fibrinogen degradation products that inhibits thrombin. This is the chart showing the fibrinolytic system. Damaged endothelial cell produces a thrombomodulin which is going to bind to the thrombin which is released into the circulation. This complex activates protein C to the activated protein C, and with the cofactor protein C, it is going to inhibit the factor 8 and factor 5. Thus, they act as the anticoagulant. They also inactivate the inhibitor of tissue plasminogen activator, that is TPA, and thus it is going to increase the generation of tissue plasminogen activator that converts plasminogen into plasmin, a strong fibrinolytic, which is going to cause fibrinolysis, releasing lysis fibrin. And the thrombin, tissue plasminogen, and uroplasminogen also helps in the conversion of plasmin into lysis fibrin. Anticoagulants. Heparin is a mucopolysaccharide natural anticoagulant secreted by granules of mast cells and basophils. It facilitates the action of antithrombin 3 and thereby inhibits the active forms of factor 9, 10, 11, and 12. Vitamin antagonists can be classified into dicumarols, warfarin, and phenidine. Vitamin K is essential for liver function, liver formation. Vitamin K is essential for liver formation of clotting factors like 2, 7, 9, and 10. All these factors are synthesized by the liver as inactive zymosins. Oxalate compounds. They prevent coagulation by forming calcium oxalate. Thus, calcium is removed from the blood. A mixture of ammonium oxalate and potassium oxalate is in the ratio of 3:2 is used. Potassium oxalate alone causes shrinkage of RBCs. Ammonium oxalate alone causes swelling of RBCs. But together, these substances do not alter the cellular activity. Whereas citrates combine with calcium in blood to form calcium citrate. Reduction of calcium levels prevents coagulation. Sodium, potassium, and ammonia citrates are used for the purpose. EDTA. This prevents clotting of the blood by removing calcium from the blood. The other things which where the blood is kept in a fluid state is by keeping the low temperature of the blood, keeping it is in a siliconized vessels, and diluting with the saline. They may help in maintenance of fluidity of the blood. Abnormalities of hemostasis. Thrombosis. Formation of the clot inside the blood vessels is called as thrombosis. Van Willebrand's disease. Deficiency of Van Willebrand factor causes bleeding disorder called as Van Willebrand's disease. This protein is responsible for platelet adherence to endothelium of blood vessels during hemostasis. Van Willebrand factor complexes with factor 8, and in circulation the complex as a whole circulates. Thus, it is responsible for survival and maintenance of factor 8 in plasma. In von Willebrand's disease, platelet adhesion is reduced and thus hemostasis is affected. So, this is how the platelets gets adhered to the subendothelial collagen with the help of one relevant factor and also with the help of glycoprotein 1b. Hemophilia. It's a bleeding disorder due to deficiency of some clotting factors that occurs exclusively in males. It is an inherited sex-linked anomaly due to abnormal gene on X chromosome. Here clotting time is prolonged, but bleeding time is normal. Treatment. Treatment could be the fresh blood transfusion. The factor it is because factor 8 is lost on storage. Then by giving injection of factor 8 and factor 9, or by injecting thrombin or thromboplastin. The hemophilia can be of two types, hemophilia A or hemophilia B. Hemophilia A is also called as classical hemophilia, where factor 8 is absent and it is relatively common. Whereas hemophilia B is also called as Christmas disease, where factor 9 is deficient. So this diagram shows the inheritance of the hemophilia, where here the females are carrier and the 50% of the females born are they are normal and 50% are the carriers, and 50% of the male they are born are normal, whereas 50% they are affected because of the X-linked recessive disorder. Purpura. It's a condition characterized by spontaneous hemorrhages beneath the skin, mucous membrane, and in the internal organs. Bleeding time is prolonged. The normal is between 2 to 5 minutes, and clotting time is normal. This may be due to decreased platelet count, that is thrombocytopenic purpura. It can be drug induced like quinine, ergots, and iodine. It can be because of defective capillary contractility as well. The different forms of purpura are thrombocytopenic purpura, where there is a reduced platelet count, thrombocytopenic purpura, that is normal platelet count, and thrombocytopenic purpura, where is abnormal circulating platelet but the count is normal. Here the physical the shape of the platelet is abnormal. Treatment by injecting corticosteroids or ACTH, or it can be done by splenectomy. This is a diagram showing the peticase in thrombocytopenic or thrombocytopenic purpura, where you can see small raised areas of bleeding underneath the skin. This is regarding the fibrinolytic system in brief. Thank you.